Depression casts a long shadow across the globe. It's a leading cause of disability, affecting millions. In the United States alone, almost 10% of adults grapple with this condition. Unlike a broken bone, depression is a mental illness. This makes it harder to understand and address. Depression can strike anyone, regardless of age, background, or social standing. It's not a sign of weakness, it's a serious medical condition that demands attention and care. The impact of depression extends beyond the individual. It touches families, communities, and workplaces. The good news is that depression is treatable. With awareness, understanding, and support, we can help individuals reclaim their lives. We all experience sadness. It's a normal human emotion, often triggered by specific events. A bad grade, a job loss, an argument, these can all leave us feeling down. This kind of sadness is usually temporary. As circumstances change, our mood lifts. Clinical depression is different. This is a medical disorder characterized by persistent low mood. It's not just a case of the blues. It's a pervasive sadness that lingers for at least 2 weeks. This persistent low mood significantly interferes with daily life, affecting work, relationships, and leisure activities. Clinical depression requires professional help. It's essential to recognize the signs and seek appropriate treatment. Early intervention is crucial for a positive outcome. Clinical depression manifests in various ways. Recognizing the symptoms is crucial for early diagnosis and intervention. Here are some key indicators. Depressed mood. A persistent feeling of sadness, emptiness, or hopelessness. Loss of interest. Diminished pleasure in activities that were once enjoyable. Appetite and weight changes. Significant weight loss or gain, or changes in appetite. Feelings of worthlessness, excessive guilt, self-blame, and feelings of inadequacy. Sleep disturbances, insomnia or difficulty sleeping, or hypersomnia, excessive sleeping. Poor concentration, difficulty focusing, making decisions, or remembering things. If you experience 5 or more of these symptoms for at least 2 weeks, it's essential to consult a healthcare professional. They can make an accurate diagnosis and recommend the most effective treatment plan. Section 4. The brain's blueprint of depression. Depression isn't just in your head, it has a tangible presence in the brain, affecting its structure and function. Brain imaging studies reveal differences in people with depression. For instance, they often have smaller frontal lobes and hippocampal volumes. These areas play a crucial role in mood regulation, memory, and emotional processing. Neurotransmitters, the brain's chemical messengers, are also implicated in depression. Imbalances in serotonin, norepinephrine, and dopamine are commonly observed. These neurotransmitters influence mood, sleep, appetite, and motivation. Other biological factors contribute to depression. Disruptions in circadian rhythms, the body's natural sleep-wake cycles, are common. Hormonal abnormalities such as imbalances in cortisol, the stress hormone, and thyroid hormones can also play a role. Section 5. Navigating the maze of causes and treatments. The causes of depression are complex and multifaceted. It's rarely attributed to a single factor. Instead, it's often a combination of genetic predisposition and environmental triggers. Genetics play a role in an individual's susceptibility to depression. If a close family member has depression, the risk increases. However, having a genetic predisposition doesn't guarantee you'll develop the condition. Environmental factors act as triggers, activating the underlying vulnerability. Stressful life events such as trauma, abuse, job loss, or the death of a loved one can contribute to depression. Chronic stress, social isolation, and childhood adversity can also increase the risk. Fortunately, effective treatments for depression are available. Medications such as antidepressants like SSRIs and SNRIs help regulate neurotransmitter imbalances. Therapy, including cognitive behavioral therapy, CBT, and interpersonal therapy, equips individuals with coping mechanisms and helps address negative thought patterns. Section 6. Lending a helping hand. Supporting someone with depression. Supporting someone with depression can be challenging, but it's incredibly important. Here are some ways to help. Encourage professional help. Gently encourage your loved one to seek help from a mental health professional. Offer to assist with finding a therapist or making appointments. Offer practical support. Depression can make everyday tasks feel overwhelming. Offer to help with groceries, cooking, cleaning, or childcare. Validate their experience. Let your loved one know that their feelings are valid. Avoid dismissing their struggles or comparing them to temporary sadness. Promote open conversations. Create a safe space for open and honest conversations about mental health. Talking about depression helps reduce stigma and encourages help seeking. Remember, depression is a medical condition, not a weakness. Recovery is possible with the right treatment and support.